All right. Well, in the interest of time and just wanting to make sure that we have time for all of the content that we have planned today, I want to go ahead and get started. So, this is our Leadership Connection series. My name is Tiffany Love, and I will be the host of the show today. And we are so happy to have Jonathan Watkins here with us today. Jonathan, I've known you for many, many years. I think we've kind of known each other superficially and on social media, and we've kind of followed each other for a very long time. But then this year at Congress, you and I had some real quality time together. I had six of my proteges who I have coached and mentored over many years, and somehow you you got engaged in a conversation with us, and it was so, I'm getting chills just thinking about it. It was so inspiring. We all walked away like on cloud nine. It was amazing. So that's why I had to invite you to be a guest today because we need more of that energy. So I want to take a minute to let you introduce yourself to the audience, share your current role, where you work, and let's start there.
Absolutely. Well, Happy New Year. And again, thank you for the opportunity. I did indeed enjoy connecting with you and your team in Houston. In fact, that was the first Congress in Houston. And I know we're going back this year, so it was nice to be there. But again, my name is Jonathan Watkins, guys, and I have the proud privilege of serving as the president of City of Hope Atlanta. City of Hope Atlanta, or City of Hope, is one of the largest nonprofit cancer research and treatment organizations in the United States. Our epicenter is a National Cancer Institute designated medical center outside of Los Angeles in Duarte, California. And we're ranked amongst the top 10 best hospitals for cancer care in the United States. I understand that much of the audience is probably East Coast or from the South, so the name City of Hope and our health system is probably not one that a lot of people are familiar with. But our history dates back, guys, to the early 1900s. When we began, we weren't a hospital at all. In 1913, a group of volunteers set up two tents to help those affected by tuberculosis. One tent was for the volunteers, another tent was for the patients that were sick and dying of the disease. And at the time, individuals with TB were being shipped to the desert, which is now, as we know it, Duarte, California, where they would unfortunately die alone, a pretty miserable and tough death. Well, the volunteers and caregivers that began assisting this group gave them hope. And when it became time, or when many of them passed away, they did so with dignity, which gave birth to the name City of Hope. When antibiotics began to turn the tide on tuberculosis, those volunteers didn't disband or quit. They doubled down on even more challenging illnesses, founding an institution of medicine and research in the 1940s that focused on cancer and other life-threatening diseases. So over the next 70 or so years, our research and the work has created and led to incredible milestones and groundbreaking discoveries at the hands of our scientists and researchers, many of which are used by health systems, probably from members of the audience right now. We launched one of the first bone marrow transplant programs in the country. We discovered synthetic insulin, which is used to treat diabetes all over the globe. Prior to the creation of synthetic insulin by City of Hope, animal products was used to manufacture the drug, and it made the recipients of it very sick, and it was just tough to digest. And we developed a number of what we call smart cancer drugs, which identify and target the specific cancer cells based on individual gene mutations, things that are done by scientists and researchers much smarter than me and that spend hours in the lab and whose education far exceeds mine. We developed groundbreaking gene therapies that treat HIV. So our medicine, our research, our science, again, extends all over the globe. Here in Atlanta, though, we haven't always been City of Hope. Probably most of the audience likely knows us by our legacy name, Cancer Treatment Centers of America, or CTCA. CTCA was a for-profit, private equity-backed health system that was established in 1988 by a businessman, an entrepreneur. His name is Richard Stevenson. Now, the founding of CTCA is so similar to that City of Hope. Mr. Stevenson's mother was diagnosed with cancer, and despite his wealth and access, and again, his means and resources, he was disappointed with the treatment that she received. And he was really bothered by the bifurcated approach to care that required them to seek treatment in different buildings and different locations. So he said he was going to build a hospital and an organization, a health system that focused solely and only on cancer and placed all of that patient services under one roof. He started by purchasing a hospital outside of Chicago and ultimately expanded into Oklahoma, Pennsylvania, Arizona, and then Georgia. And in 2022, City of Hope purchased CTCA, again, creating one of the nation's largest treatment and research organizations. And while no merger or acquisition is without its challenges, I have been beyond impressed with and appreciative of the approach that we've taken in our integration and creation of One City of Hope. Our work has been rooted in our mission, which is to make hope a reality for all that are touched by cancer and diabetes. And our geography is truly our strength, particularly when we talk about the clinical trials that we distribute across our system. Our proximity, or I should say, our placement in each of these markets generates and allows us to create and see a diverse pool of patients that age tremendously when working to combat the second leading cause of death. So I've been with the organization now for 5 years, and I couldn't be more pleased and appreciative of the work that we do.
So I had looked at your website just to, try and do my homework and learn a little bit more about the organization. And I just want to read the description that's on your website because it struck me. It says, City of Hope is a world leader in the research and treatment of cancer, diabetes, and other serious diseases. We deliver scientific miracles
Mhm.
that make lives whole again. I have never seen an organization so boldly say that they deliver miracles. And I'm getting chills again because it inspired me. It made me hopeful. And if I was suffering, yes, I want to go to the place that's delivering miracles.
It
So,
is, it's an inspiring organization to be a part of. Whenever I have a meeting get canceled, and I think we all, as executives and leaders, love that gift of time we get when a meeting is
mhm.
canceled. I take the opportunity to round through the facility, and in my rounding, I oftentimes have the privilege of just talking to patients, and I hear how patients have uh, navigated their cancer journey. They've started in one system, been told to get their affairs in order, only to come here in search of hope and meet a physician that puts them on one of the groundbreaking clinical trials or some of the research that we're doing. And they're 5 years along in their journey. They're 10 years along in their battle against cancer. It's a moving experience. And I invite people all the time. And if you're ever in the Atlanta area, Dr. Love, would love to have you come by and see
Yes.
the facility. I place it up against any organization that exists out there. In fact, another fun fact about City of Hope, its history and just all it brings to the table. We're all familiar with St. Jude's, the Children's Cancer Research. Well,
Mhm.
St. Jude was founded upon those same principles at City of Hope. Their founders flew to Duarte, flew to California, because from 1913 until the mid 1980s, City of Hope, much like St. Jude, didn't take a dime for patient care. It became, as you can imagine, much more complex and expensive and so forth, as healthcare became a more profitable institution and just things shifted to that we had to pivot. But that mission, that root of really uh, sending and creating miracles is still there.
Yeah. So now I want to pivot a little bit and I want to transition into you sharing your career journey. Because even though I talked to you quite a bit at Congress, you shared a little bit of your journey, but I really want to know how you got started, how you advanced.
Yeah, I've been extremely, extremely blessed and fortunate. So I grew up in Memphis, Tennessee, originally born and raised there, very proud Memphian. Working poor family. My parents preached to my brothers and I the importance and the value instilled in us education. And during a career day in high school, a gentleman named Dr. LaDon Jones, who was the senior vice president of operations and patient experience at the Baptist Health System, came to my high school and spoke. And I'll never forget it. And I wasn't a bad student, but I wasn't the greatest student either. So
Mhm.
I was one of the guys and the kids in high school asking, some of the silly questions. But one of the things we all wanted to know during career day, as each of the professionals navigate through the class, was how much money do you have to make and how long do you have to go to school to do that? And in our discussion with Dr. Jones, he answered the question for us. And he also pivoted, though, and told us about his journey in school. And then he started to do the math around his lifespan and did the math for us around how much time in school that if we put forward and what that could look like for us. So he just broke things down in a way
Right.
that connected and resonated with me. So much so that I left the classroom after his presentation, went to the guidance counselor, Mrs. Jenkins. I'll never forget Mrs. Jenkins as well. I said, Mrs.
Mhm.
Jenkins, I know exactly what I want to be when I grow up. I want to be Dr. Jones. She said, that's great, Jonathan. What does Dr. Jones do? I said, I'm not sure, but he had on a nice suit. He told us what kind of car he drove, and he makes a lot of money. I want to be him. So she laughed at me and grabbed the agenda from the program and saw his name, saw what he did,
Mhm.
and helped me do some research on healthcare administration. Well, one of the schools in my state, Tennessee State University, happened to have a program. So I applied to school, a number of schools, and got into Tennessee State, received a scholarship to go there, and went and majored in healthcare administration. Well, as a part of the degree requirement, we were we had to complete an internship. And
Right.
the Tennessee Hospital Association has the Agenda 21 program. It's a program that's geared and aimed toward helping students transition from college into the field of healthcare administration. Well, I interviewed with the Tennessee Hospital Association, and that interview went well. They then said, well, we have a partnering hospital in Memphis, and since you're from there, we can help you defer the cost of housing by sending you there to interview. Like, great. I don't have money for housing anyway, so this will be perfect.
Right.
So I interviewed with a few people at the Baptist Health System, and they said, well, ultimately the decision maker will be Dr. Jones. He'll be in shortly. So I'm sitting and waiting, and who walks in? The same Dr. Jones that spoke to my high school 6 years prior.
Oh, oh my God.
So I'm in awe as he walks in, and so we start talking, and I share with him the story of him speaking to my class and how he's the reason why I'm there.
Right.
Fast forward, I get the internship, of course, and he
Mhm.
becomes one of my first mentors. And at the time, I didn't really have a concept around what a mentor meant. But
Mhm.
in those conversations with him about professional attire, um, professional etiquette,
Yes.
he took me to Rotary Club meetings with them where I learned about table etiquette,
Hmm.
just how to shake a hand, look a man in the eye, just all these little nuances that
Wow.
growing up in Memphis I hadn't experienced, but that would become invaluable and are still used today as I navigate my professional career. Well, after
Hmm.
graduate school, oh, excuse me, after the internship, I went on to graduate school. Fast forward, worked in different organizations, and joined the Methodist Health System. And while in the Methodist Health System, had the privilege of connecting with another gentleman, Dr. Michael Ugwecki. Dr. Ugwecki was the CEO of Methodist South Hospital, and I was a project manager in the health system. Well, I
Okay.
sent him a note just congratulating him on his entry into the organization. Said I would love to someday meet him and pick his brain. Of
Hmm.
course, he was receiving a zillion emails. I didn't get one back. But
Right.
the health system had a program that it was kicking off the ground called that the IHI the Institute of Health Improvement was sponsoring. It was an initiative around executive patient safety rounds. And the premise of it was getting executives out of their offices and out of the boardrooms, even the board members, and getting them into the hospitals, into departments to talk about safety, to talk about those bottlenecks and items and issues that
Right.
were impediments to frontline employees doing their work. Well, the system needed someone to serve as a project manager, basically the note taker for those executives as they went out into the hospitals. And my buddies and the other project managers all declined the opportunity. They didn't want it. I raised my hand for it,
Hmm.
not because I love taking notes, but because I was interested in the FaceTime with all these C-suite executives and our board members.
Right.
Because I knew in those 15, 20-minute rides the car around our city to the different hospitals that I was going to get to pick their brains, and or what happened more than I thought was them asking me questions. They were more interested in my career aspirations and goals and desires. And through those relationships became mentorships. So when Dr. Ugweki's role expanded, he was kind enough to bring me to Methodist North to serve as his assistant administrator. 2 years into that role, he became our system COO and was kind enough to promote me to the interim CEO. It was only supposed to be a seat that I occupied for a few months because they thought they had a candidate in mind. But that candidate ultimately ended up using that role that Methodist offered him for a permanent role in his system. Well,
Mm.
that meant Jonathan got to sit in that CEO seat longer. I
Right.
got to interact with the board. I got to interact with our frontline community officials and elected officials, and just really started to understand executive presence, start to understand what it meant beyond running the day to day in the hospital and being an assistant administrator, that community aspect of it. Uh, but still young in my career, they ultimately selected someone else, that Jossie Chisley, another gentleman that ultimately became a good friend and mentor of mine, to come in to be the CEO. He and I worked side by side for a few years and really, really, really made some, I think, outstanding accomplishment achievements in that hospital and system that are still there today. Um, from there, I moved to California and was recruited to join Kaiser Permanente, where I, again, just being blessed, I think, I met another gentleman, Corwin Harper, who is still to this day a just stable figure in my life, professionally as well as personally, who really taught me a lot the importance of work-life balance. You know, we often work so hard to ascend and to attain the titles and the accolades that come with the role, but there can be a cost that come with it. And just the wallpaper on my backdrop just speaks to some of that as it talks. And those are the Golter gates. Those are huge gates that sit at City of Hope. And it says there's no profit in curing the body if it's in the process you destroy the soul. And Corbin used to talk about those types of things. There's no point in attaining all this money and these accolades and so forth if in the process you lose who you are. You know, you lose your family, your health deteriorates, all those different things. So from Kaiser Permanente, I was recruited to join Broward Health in Fort Lauderdale, Florida, where I served as a CEO of one of the hospitals, my first CEO opportunity.
Mm.
From there, Jossie Chisley, the gentleman that was my CEO in Memphis, he joined Cancer Treatment Centers of America. He called me to say, hey, I want you to take a look at this opportunity to come here. The organization is looking at selling, and they want to kind of change the model to a more traditional model, and they want somebody with your experience. So he recruited me here, and I've been here since then. And I've been, again, beyond blessed and extremely fortunate in that I've literally, the last time I actively looked for a job was out of graduate school. And
Wow.
that was when I joined the US Government Accountability Office. And from there, it's been somebody recognizing something in me, or a friend of a friend, or a recruiter, or so forth, reaching out. And it's, again, been my ascent through the industry.
So you have had so many powerful mentoring and sponsorship stories, and a lot of people just, it sounds like you didn't even ask. It sounds like these people just kind of took you under their wing, or maybe you kind of did it in a subtle way. Because I feel like if you ask, people are more inclined to say, well, I really don't have time to be a mentor. And of course,
Mhm.
sponsorship is something that they kind of really have to decide, yes, I want to help propel this young man's career.
Yeah, so it was a little of both. I did ask Dr. Ugwecki and Corwin. In fact, I was at Congress and I was walking through, and this was years ago. I had a bow tie on, and he had a bow tie. He
Mhm.
stopped me, complimented my tie, and we started talking. He was asking me about my career, and if you ever meet or know Corwin,
Oh, I
he
do.
asks these direct questions, and how do you respond? And this, and
Hmm.
he said, "I like you. I'm going to mentor you, young man." And sometimes you'll have people, give you their card or take your card and say, "I'll call you," or you call them, and they don't always respond. Well, true to
Mhm.
his word, he did it. Uh, but one of the things that I think what I've found in just in my journey in terms of sponsoring and mentor, talking to people that I'm potentially considering sponsoring, mentoring, is their lack of interest, and I hate to say it this way, in doing the work.
Mhm.
It wasn't just like I became, these gentlemen's mentor, or excuse me, mentee, because they liked me. They saw
Mhm.
my work ethic. They saw that there was a hunger and a desire to execute and deliver. In fact, if you ever talk to Corwin, he sends you a template. It's about a 5-page um, 5-year plan. It's a SWOT analysis. It's a bunch of questions to think through, and he walks through that with you, and he wants to know how seriously you're going to take it.
Mhm.
And oftentimes people don't. I've found it that people don't. They won't complete it, or
Right.
they'll half do it. They'll tell you they'll get. You never hear from them, and that's been honestly one of my quickest ways. I hate to say it this way, but weeding people out. If I don't
Gotcha.
get that document back, and I send it to you and you don't
Mhm.
ask for help, you don't ask for anything, that's a pretty clear indicator of where you sit and where you are interested in.
Right. And I think when people are asking for someone to mentor them or to coach them, they don't realize it's an investment for us, right? I mean,
Oh,
it's
absolutely.
sweat equity, you know?
Indeed.
Um,
Yes.
so yeah, they have to be willing to do the work. So I'm glad that you mentioned that. Um, so now I want to think about, I love to hear about your experience as a CEO of a venture capital funded organization because it was a huge transition. You've worked in the for-profit, then you
Mhm.
have that venture capital, which I feel like that's different. That requires a different mindset as a CEO to lead. And then to go from having that venture capital funding to now, aren't you a nonprofit hospital?
Right.
So
Yeah.
I feel like as a CEO, that requires different leadership skills, a different mindset. Like, so can you just kind of walk me through the transitions of going from that for-profit to the venture capital? Like that to me is like the first shift in how you lead.
It is. It's they're totally different organizations in the sense of the pace. When you're with venture capital, private equity backed, uh, they're the foresight or the vision into the organization is a lot shorter. Meaning, because most times the strategy and the goal is an exit meaning a sale. So
Mm,
you're trying to churn and get as much money, make the organization as profitable as you can
right.
so that you can in turn look for, okay, how do I sell this and
Mm,
generate a multiple on top of this? So whereas a traditional like City of Hope, we're
mm-hmm.
talking and thinking 5 years down the line. We have
Right.
a 5 and a 10-year strategic plan. That was not the case. We weren't even thinking 5 months down the line. It was what is happening this month, what is happening this quarter, how are
Mm,
you course correcting, daily
right.
revenue calls, daily revenue looks. You learn your metrics and your numbers at a clip beyond belief in that private equity in that for-profit space because the patient's in there. And the money is all money that's been invested in the organization by individuals. Like
Mm-hmm.
City of Hope doesn't have any individuals' money tied in it.
Right.
So there's a lot more patience when it comes to how we're performing this quarter versus Cancer Treatment Centers of America. That
Mm,
was Brown Legacy Group, which was the PE firm, that was those venture capitalist dollars tied into that organization. So when it's not doing well, you got real people that you can see that feel that financial pressure and that own that
Mhm.
versus in a nonprofit organization, while the boards of directors, again, they want to return, they want to see how you're performing, they want you to hit your targets, but it's not their money, if that makes any sense. So when you
Mhm.
lead, both institutions require you to have, I think, a high level of emotional intelligence because you've got to read the room and you've got to really understand the people you're working with. But the for-profit piece of it, you've got to be able to quickly turn and quickly adjust your game plan if and when necessary. There isn't a
Mhm.
lot of time to and patience with, okay, I've got to get everybody on board. Okay, I've got to make sure I socialize this topic and that everybody's comfortable with it. You get with us or you get left
Right.
in that for-profit space.
Oh my gosh. So that makes me think your budgeting, your budget planning, the way that you handle finance must be so drastically different between those different organizations.
Oh, 1000%. It's all about the again your EBITDA, your bottom line, like how are you performing, what are you doing, and the
Hmm.
expected return
Right.
from it versus so just concrete example. When I joined Cancer Treatment Centers of America,
Mm-hmm.
I approached my first monthly business review and board meeting the way I'd been accustomed to do it, where you go through each of your pillars, your people, your service.
Hmm.
And I got cut off pretty quickly. It's like, yeah, those things are fine, but let's get to the dollars. Like we
Right.
quickly wanted to evaluate and assess how we were performing financially.
Wow.
Again, because that's individual groups' money, and that determined whether or not they could continue to invest. When I needed more equipment, I had to go back for dollars. And we
Mhm.
have a very, very advanced and high tech facility. So the Da Vinci robot, if I need
Right.
$2.3 million, that's literally coming out of an individual's pocket that I can see and touch.
Wow.
Versus at City of Hope, yeah, my board has to approve it, but it's not
Hmm.
their it's not their money.
Right.
And
Wow.
so that brings about a totally different view and look at it. The way you own and understand your P&L, you understand drug
Hmm.
costs to the
Hmm.
dollar, you understand your top three drugs, your top five drugs, like at that level, when you're running that for-profit institution.
Yeah. So let me ask you this. How do you think that impacted the culture? Like, did you notice cultural differences between like leaving Kaiser and then going to the cancer, the venture capital hospital?
So the interesting thing about it is, and this is no shot at Kaiser at all, because both
Hmm.
organizations and institutions have amazing cultures. The culture at Cancer Treatment Centers of America was arguably, when I talk about culture, I'm talking about those frontline, sharp end of the blade healthcare that they're touching the patient, arguably
Hmm.
one of the best I've seen. The
Wow.
chairman, when he founded the organization, I mentioned earlier in my introduction that he talked about his mother being diagnosed with cancer and this concept. And with that, they brought about this concept called the mother standard of care. And
Hmm.
he would talk about it and tout it in a way that really resonated with people. So when I got here, the patient satisfaction scores were the top tier. I mean, they were a 5-star facility in patient satisfaction. Everybody truly believed in that mother standard of care. So
Hmm.
each individual that walked into the hospital, you treated the way you would treat your own mother, or you would want him or her treated by individuals that they connected with.
Right.
And that proliferated through the organization like I'd never seen before. I
Wow.
will add, though, the organization was making money hand over fist. So when you're
Hmm.
making money like that, it is easier to uh, generate and bring about a good culture because you were paying people very generously.
Hmm.
So that pivot and that shift was difficult there because when I joined is when we started to really become more of a traditional hospital system.
Okay.
We'd gone from an out-of-network organization where we were reimbursed at probably a combined rate, probably I think it was over 600% of Medicare at the time, to a blended rate now
Mm.
probably 220, 250%. So that with that eating into your cost and you being unable to do some of the things that they did, that was one of the biggest shifts that I had to uh, navigate when I joined the organization, which was a challenge. But
Mm.
they had an amazing culture, but that culture was heavily predicated on the dollars that were spent, the raises, the
That's right.
uh, end of year celebrations, like all these different things.
Yeah. So you have made a lot of transitions in your career. And I want you to think about what was the biggest challenge that you faced in these transitions? Was there a transition that just really seemed like, wow, this is a little harder than I thought? And how did you get through it?
Yeah, the transition from Broward Health to uh, CTCA was a pretty big one, in part because so when I joined Cancer Treatment Centers of America, we were a destination cancer facility.
Mm-hmm.
uh, Meaning, and the certificate of need restriction capped our ability to see Georgia patients at 35%. So literally, if you lived one block from this institution in Summer Grove, it's a subdivision near the facility, and we
Mm-hmm.
were at that 35%, you couldn't come here. Uh, so we were successful in getting that lifted at the end of 2019, a few months after I joined. But in 2020, the pandemic hit.
Oh,
So I joined a destination cancer facility that relied on patients flying into it
right.
5 months before all travel shut down across the country,
Oh my God.
which made me wonder, wow, what was I thinking? What did I do?
Right.
Uh, you combine that with the fact that we were, again, still pivoting and going from out of network to in network with our payers. So we had a lot of payer contracts that um, really weren't the most favorable. They were heavy volume based contracts. And
Mm-hmm.
with everything shutting down and us trying to navigate how we were going to get patients referred to the facility, that made it difficult. You combine it with that, from my understanding, and again, walking in it, a little arrogance as well, if I'm being 1000% transparent, thinking this is a single specialty facility. I worked at Kaiser Permanente. I worked in the
Right.
Methodist system. I just was at Broward Health. Every patient has one single disease. That's easy. Well,
Mm-hmm.
yes, every patient has one single disease, but those patients have those same needs. You still have neuro, you still have cardiac, you still
Right.
have ortho. So that was somewhat naive on my part to think that it was just going to be this simple space and place. But navigating the
Mm-hmm.
pandemic uh, after a few short months after joining the organization was probably one of the biggest challenges I faced.
Wow. All
We
right.
were successful though in standing up our telehealth program, and this is where I
Right.
give huge kudos and credence, and I'm pointing to the other side of the facility where our physicians and clinicians are. They were agile and just versatile in their thinking, and really helped us in standing up a lot of initiatives that saved the organization, ultimately positioning us for success for the sale to City of Hope, and we've continued to succeed since then.
Mm. So, I mean, we've talked about how you've had to like basically develop new leadership skills going through the pandemic, going through the transition of the hospital, changing its financial structure. And so I want to ask you, when you think about healthcare today and maybe 10 years down the road, what are the skills that you think a healthcare leader needs to be successful? Like, what are the key attributes that will help a leader today be just as successful over the next 10 years?
Yeah, I think the one consistent thing that you've got to have is you've got to have compassion. Like you literally have to really love the patients.
Yeah.
that we're responsible and in charge with taking care of.
Mhm.
Cornell West has this quote: "In order to lead them, you must love them. In order to save them, you must serve them." And you
Mm.
really have to bring those true attributes to the table, and both loving what you do, but also a servant's leadership approach to it. I think agility is going to be required no matter what decade or generation or what space you look to serve in. Thinking that you can set and establish a plan in January and it'd be the same in December, you won't be successful in this industry. There's always change coming at you, and your ability to navigate that is going to be important. I think the ability to communicate. I know we believe that, and AI is going to change a lot of that, but when it becomes time to sit down in front of a person, because we are in very much a people-centric, touch-to-touch industry and space and place, you've got to
Mhm.
be able to have and navigate those types of conversations. So those are a few essential skills and just tools that I think people will need, in regardless of whether it be today, 10, 20 years down the line.
Mhm. So let me ask you this, because I know that you're a member of ACHE, but what other professional societies are you a member of?
Yeah, so I'm also a member of a Young Presidents Organization, YPO.
Oh,
YPO is a national, or actually it's an international organization of presidents and CEOs, most of which are under the age of 45.
wow.
You can be grandfathered in once you've joined and you can stay in, but I've really found YPO to be beneficial because it's exposed me to professional executives outside of the healthcare arena and space, and you get
Hmm.
to listen to in our meetings and discussions. I hear what people that lead retail are navigating.
Hmm.
The CEO of Edible Arrangements is in my forum, and your forum
Hmm.
is basically your small cohort that you meet with. And I hear about navigating, which many people don't know, is a family-owned business, and the challenges that come along with it.
Hmm.
Have people in marketing. And so that exposure has been great. I'm a member of the National Association of Health Service Executives.
Hmm.
And through it, I've been able to meet and connect with a number of just great professionals. I also serve on some chamber boards and a part of several of those. And uh, not necessarily professional, but uh, my national fraternity, Alpha Phi Alpha, which I'm a proud member of, strong brotherhood with executives and members of it, that
Hmm.
mentor as well as allow me the space and place to be vulnerable and kind of talk about some of the challenges and talk about what I'm navigating personally and professionally.
So I'm glad you kind of went over to the personal, because as we were talking, I was thinking you, much like me, have made transitions that have taken you across the country. And so, how, for people who are pursuing those opportunities where they have to relocate their family, because you're a family man, right?
Yes,
How do
indeed.
you navigate that with your family? I mean, you're negotiating with your wife and your kids, and I mean, there's a lot going on there. What would you advise someone who is trying to take that same strategy of being willing to relocate? Like, what advice would you give them on how to really make sure they are supporting their family as they're trying to advance their career?
Yeah, I would say have the conversations early. My wife and I, even before getting married, one of the conversations we had was about her career as well as mine. She's an OBGYN
Yeah.
and had dreams and aspirations of what her career would look like. I had mine, and we had very, open and candid conversations about them because somebody's career was going to have to take a back seat.
Mhm.
Um, we played rock paper scissors. No, seriously.
Yeah.
I committed to doing my part to make sure that she and my family remained whole. And we both agreed that once we started to have children, we were blessed and fortunate to have one little girl. She's
Mhm.
7, going on 17. But that when we got to a certain phase and stage, we would do all we could. I would do all we could, and what I needed to do to make sure that she stayed stable then. And
Mhm.
Jenna has only had to move, well, that she can remember once because she
Okay.
moved shortly after being born from California to Florida,
Mm-hmm.
and then from Florida to Georgia. So we that has in turn kind of shifted my thinking around, okay, what am I chasing? Going into this, it was fine for me to go any and every opportunity that came. Now I look at those opportunities totally differently. When I get a call, it's not just about the title and the organization as much as it is what the organization has to offer, but also what it has to offer me. But what does it offer my family? Will we be
Right.
able to create a similar ecosystem that we've been able to create here in Atlanta, where my wife can is now practicing medicine at Piedmont on a schedule that allows her to still, be a full-time mom. We have been able to connect with people that have allowed us to establish a support system around us because we don't have family here. But
Right.
I would encourage, again, to your direct question, have those conversations up front and early, and
Mhm.
be willing to sacrifice because I have turned down and not taken every opportunity
Mhm.
because it wouldn't have been one that advanced the family. Because at a certain point, as I mentioned, it becomes less about my personal advancement or professional advancement and about the family's goals.
Mhm. So now in our chapter, we have young professionals, we have people who are, very senior, and the ones that are kind of in between, those middle managers trying to figure it out, well, we know that a lot of people get stuck in those middle management roles and never
Right.
advance beyond that. So what career advice would you give to someone who is maybe they made it past the early careers phase and they're more at the frontline middle manager role? What advice would you give them?
I would ask them to, again, put their own plan together, be very specific about what they want to do. I
Mm-hmm.
found in talking to a lot of people when asking, so what do you want to do? I want to do operations.
Hmm.
Operations in the role. It's not, it doesn't, I can't help you do operations.
Right.
So if you can, try to be as precise and clear in your explanation of what you're trying to do and what you're doing to get there, so that when you do come across someone that pose that question to you that has connections, or you at least leave an impression on them, so when they hear of an opportunity to advance, they think
Hmm.
of you. So I would say be clear in what you really want to do. Also be working towards it now. There are a number of people that aren't leveraging the professional organizations that exist. They aren't leveraging ACHE. When asked, why, oh, you got to pay to join. And I'm like, yeah, but I'm looking at your shoes. Those are Ferragamo. I know what you paid for those,
Right.
man, but you won't pay for ACHE. Or I'm looking at this nice handbag. My wife
Mhm.
carries those. I know what they cost, but you won't pay. Like that, those types of things, they've got to be willing to put, aside. And you also may have to, be willing to go laterally before you go upward. Those are things that you've got that sometimes are hard for people to recognize and realize. Stepping out of one system into another one, into a lateral role because that system is larger and has more opportunities, is something people should consider as well.
Yeah. Are there any educational offerings or trainings or certifications that you've taken that you really felt like help you stand out with your resume?
I'm biased towards Lean Six Sigma.
Hmm.
I
I'm
really
agreeing now.
believe that, yeah, and I still use a lot of the principles and the thinking around it, especially in this environment we're in now, where we have to be
Mhm.
more cost conscious. Everybody's thinking about reducing waste and eliminating variation, in your health systems and your organizations. So I'm biased and partial towards it. There are others, but becoming a PMP. Project management professional, because again, you get
Mhm.
some of those organizational skills that are
Yes.
transferable. And then naturally, I'm a huge proponent of becoming a fellow if and when you
Mhm.
meet the criteria within ACHE.
Absolutely, absolutely. So let me ask you this. Are there any special leadership books that book that you might have read twice? Anyone that stands out to you as a really, like if you could have somebody read one book, what would it be?
I read the first 90 days.
Oh, I love, yep.
Yeah, probably maybe every 2 years because the organizations are changing. Even when we
Mhm.
when we when we were acquired, how
Right.
do we kind of reset then? And
Yeah.
each time I take a new role, I'll read it to reset and understand it.
Mhm.
Um, I'm reading again now Malcolm Gladwell's The Tipping Point. I'm a huge Malcolm Gladwell fan.
Yeah.
Um, so those are a couple that I would off the top of my head I would encourage people to read.
Okay. All right. So now,
Oh, and then the
oh,
5 levels of leadership. That's an easy, small one that, in fact, Jossie Chisley gave that to our leadership team. I'm a huge fan of it as well.
nice. So now, because you're such a strong supporter of mentoring and coaching, have you, at your organization, have you developed any kind of mentoring or coaching programs, or do you kind of like to outsource it to other organizations to come into your company to do that kind of work?
Yeah, so we outsource it. We have a couple of coaches that the company has historically worked with, and I've worked with in the past that I've assigned to leaders on my team, so that each of them gets a mentor and a coach to kind of help them as they navigate and develop. And it's confidential. It's their discussions. I don't weigh in on it. They have that independent opportunity. We do a 360 where they take that feedback and the coach works with them on creating and establishing a development program.
Now, I have to say, when you said coaching and outsourcing it, it kind of made me think about when people are in trouble because there are a lot of times people are assigned a coach when
Right.
there's just something not quite right with their leadership skills. So,
Yeah, no, this is
like,
more of a development. Yes, that you're right. That has that and that does unfortunately occur more than the approach I'm talking about. I'm speaking
right.
specifically in individuals that we've identified as talent, as next
Mm-hmm.
level talent, people that we want to see grow and develop. We in turn, invest in them with a
Nice.
coach. It
Wonderful.
creates a little stickiness with the organization from a retention standpoint.
Yeah.
And they also know that we're invested, beyond their existing role.
Mm-hmm. And at what level of leadership do you start considering giving people coaches?
The middle management, the director level. So if we see senior
Okay.
executive talent, potential within you, we'll start to have that conversation.
Right.
We'll talk with you about it if you're, to see if you're really interested. And
Mm.
surprise, not everyone is interested. There are individuals that are comfortable with where they are. They don't want the additional time commitment because it's
Mm.
going to take away from their families, and I 1,000,000% respect that. But
Yeah.
we do offer it. Yeah.
Yeah. So we have a few minutes left, and I see there are not like any questions in the chat. So I want to ask you, are there any final thoughts that you would like to leave with the group?
First and foremost, again, I want to say thank you for the opportunity to connect with the group.
Mhm.
We have all been called to a profession and an industry that is changing with, with every day. There are national headwinds that are occurring that we've got to
Mhm.
fight through at the federal level. Uh, but the one thing that's constant is those patients that are coming into the facility. When they enter our doors, they don't care about the federal headwinds that we're facing. They're trusting and counting on us. So I want to encourage us to keep that top of mind, keep that patient that's in front of us, keep those patients that we're charged and tasked with serving top of mind as we navigate our careers and our days. And I'll leave you with a message that my wife shares with me often. And in fact, she wrote it up for our holiday card this year. And
Mhm.
it's that many of the stresses are today are a manifestation of the prayers from yesterday. So when I come home and I'm often venting and lamenting about some of the challenges at work, she
Yeah.
reminds me of the conversations that we had in Memphis when I was an assistant administrator
Yeah.
praying for the day that I would someday be the president and CEO of a hospital. So to not get so caught up in that moment and the frustration of that I lose sight of how grateful and how blessed I really am right now. So
Oh, well, I think that is a wonderful point to stop. Thank you again for giving us your time. I know our chapter is going to really enjoy this series, so thank you so much.
thank you. I appreciate the opportunity. Looking forward to seeing you in March.